Hello, a very good evening to all of you. Today we are going to discuss the case note of a client. His name is Edward Broken or some what? I just need to see again. Sorry. Yeah, Bruker, Edwin Bruker. His name is Edwin Bruker. So we are going to write a letter to a psychiatrist outlining Mr. Bruker's history, current situation, and anticipated needs. So you're writing to Dr. Henry Robinson, and who is a consultant psychiatrist at 56 Rose Garden, Perth. And we see the letter in detail. So we have, yeah, sorry. Excuse me. Now, today's date is 22/5/2021, that is 22nd May, and you are a registered nurse at Osborne Park Rehabilitation Center taking care of Mr. Edwin Bruker for almost 3 months. Now, this Edwin Bruker is a 56-year-old patient who lives in Western Australia, who has hypertension, diabetes mellitus, acute ischemic stroke, so who is suspected to have post-stroke depression. And what about his medical background is that he was admitted to the Royal Perth Hospital on 14th of February with the symptoms of ischemic stroke, and he was treated there. So, and he was referred to the Osborne Rehabilitation Center, that's the care you are, for ongoing physiotherapy and ongoing rehabilitation therapy. So that's all we need to see here, because we are writing to a psychiatrist, not to a stroke therapist. Now, again, what we are going to see in 21st, the day after when he came to your center, immediately we started physiotherapy, speech therapy, all these therapies, and was referred him to a dietitian. So all assistive devices installed, or no problem. So he had good progress. Relatives visits every alternate day. This up to this point, it's every clear. Now we have something serious here. On 1st of May 2021, we have the data which is very relevant to the psychiatrist. So we have behavioral changes, poor appetite, depression, poor grooming, refuse to take medications, less interest in physiotherapy, does not come out of home, room, no interaction with others. And all these things we have, therefore we have started cognitive behavior therapy and daily counseling. So every data is important here. So these are the symptoms, because we know we have to outline the current situation. So to a psychiatrist, we have to say, what were the first psychiatric problems exhibited by the patient. So this becomes very important. Now we have on 18th, we saw that the patient attempted suicide, and relatives informed. They're coming on 22nd, they came, and the relatives agreed to meet a psychiatrist. Now we have some other things which are important here, that psychological symptoms which are worsening, paranoid behavior, delusions, and lack of sleep. So that's all about the question. Now, what we are going to write, what the reason for writing this letter is to outline Bruker's history. So the first part is very clear in the writing task is Bruker's history. So what is Bruker's history? It includes past medical history and past mental history, that's psychological history. The current situation. So how is his condition right now? It means after suicidal attempt. And anticipated needs. So he needs assessment and management. So this has to be written in order, nothing else. We have a very simple letter, but instead you focus on the medical problem rather than the psychiatric problem, which is expected to be discussed with the psychiatrist. Then it will become a real problem. So in your letter, you need to concentrate more on psychiatric problem and less on the medical problem he has. He has hypertension, all the other problems we have. So we have thrombolytic treatment, we have aspirin, the medicine given. All these things, we have a lot of things there. But if we concentrate more on that, we have more to say about the psychiatric problem. So we are going to write to a psychiatrist. Please concentrate more on the psychiatric things. So this is what the important information I just need to give you before we start. So this is 22nd May 2021, Dr. Henry Robinson, consultant psychiatrist, 56 Rose Garden, Perth. Dear Dr. Robinson, I make it a little bit smaller. It's too big. Yeah. Reference Mr. Edwin Bruker, age at 56. I'm writing to request your expert assessment and management for Mr. Edwin Bruker, who is suspected to have post-stroke depression. Now, we don't have anything else to write. We just requesting expert assessment and management or specialized assessment and management because you're writing to a specialist, that's psychiatrist. That's it. So where he's consulting, when is the consultation, all these things, we don't have any further data. So we are not going to include any of these things. We just need a sentence here, very clear, who you are referring to, what you need, and what is the condition. Now, the first part, we have discussed the past of the history of the patient. It means something which includes the medical history and the progress. Now, what has happened? Mr. Bruker was admitted to Royal Perth Hospital on 14 February 2021 and was treated progressively for acute ischemic stroke. I am not writing treated successfully because it's not a complete success. I can say there were some progress. So I use the word particularly progressively just because progress is there. It was good. I didn't say success. Instead of progress, I would have used successfully. But when the mean comes, successfully means it's entirely different. Progressively is different. Successfully is different. For what? Acute ischemic stroke. So I have briefed what happened. So I didn't mention thrombolytic treatment. I didn't mention the use of aspirin or something like that. Now, he was brought to our facility on 20 February on the next day, and on the next day, his ongoing speech therapy and physiotherapy were initiated. So this is what happened when he was there at your care. Now, in the subsequent days, he made good progress, marking his first phase of rehabilitation a success. That's all. So this is all about the history of Mr. Bruker. Now, what is the current situation? On 1st May 2021, some behavioral problems were observed on Mr. Bruker. This included depression, poor grooming, poor appetite, social isolation, poor medication complaints, and lack of interest in physiotherapy. So this all were listed there. So we have mentioned all those problems there. These problems has not yet solved. So we have written it in detail. In response to these, he was provided with cognitive behavioral therapy and counseling. It was written by a mental health nurse, but you can write, it's an optional information. You can write it if you need. Against what was expected, why we have written this phrase is because we have provided some therapies and we are expecting some progress, but just opposite to what was expected, against what was expected. He attempted suicide on this 18th, which was foiled by the caretakers. So the suicidal attempt became unsuccessful. Therefore, his relatives were intimated about the need of specialist psychiatric reference, to which they agreed to. So that concluded the paragraph. So the relatives were informed about the specialist psychiatric reference, to which they agreed to. Very clear. Very clear. Now, there are some objective findings. Where are they? So it's very difficult to write everything in that paragraph. So we have added those things here in the last paragraph. So it would be appreciated if you could consult Mr. Bruker to determine the exact reason of his worsened psychological symptoms, including paranoid behavior, delusions, and lack of sleeps, and provide the most appropriate management. Now, the reason why we are writing is to determine the exact reasons of the problems and providing the most appropriate management. And what were the problems? Were objective findings. What we found is that paranoid behavior, delusions, and lack of sleeps. We are doubting it maybe because of post-stroke depression. So the doctor need to confirm, the psychiatrist need to confirm and provide the most appropriate management. And that's what the total letter is. If you have any further queries regarding Mr. Bruker's condition, please do not hesitate to contact me. Yours sincerely, registered nurse, Osborne Park Rehabilitation Center. So we have written, as they asked, the history, outlining the history, the current condition, and anticipated needs. So it's in order. You can make it perfect if you have good words and connectives. So this is just a baseline information, how to write this particular letter. Thank you, and bye till we see again with another letter. So thank you.